PTSD stands for post-traumatic stress disorder, and it's a condition that results from experiencing a life-threatening event, or in some cases, a sexual exploitation. It happens not only in the military, but also in civilian life. Things like car wrecks and fires and floods and robberies and assaults can also cause PTSD, and it's not an uncommon condition. It's estimated that about 7% of the general population and about 20% of those in combat can develop the disorder. It has 4 clusters of symptoms. The first is called unwanted recurrence of thoughts or emotions or nightmares or flashbacks or events which trigger the traumatic event. The second cluster is called conscious avoidance, and that means going out of one's way to avoid thinking about it or dealing with it or coming into contact with things that remind you of the traumatic experience. The third cluster is called negative thoughts and emotions. The most common of those is not wanting to socialize, not wanting to be in crowds, having negative moods and difficulty experiencing positive moods, and often feeling unnecessarily guilty about what happened. And the fourth cluster is called increased arousal. And that's what we usually think of when we think of PTSD. Things like being hypervigilant, always scanning around to see what's going on around, if there's danger around, being easily startled, being hypervigilant at things that we normally wouldn't be. For example, at night, having to sleep with some sort of weapon, if not a gun, a knife or a bat or a stick, or checking frequently throughout the night, checking the windows, checking the doors. And the most common symptom is anger, irritability, and difficulty dealing with one's negative moods. Now, you don't need all those symptoms. You need a few in each cluster. But if you have enough symptoms, you may suffer from PTSD. Now, PTSD is a condition that doesn't go away with time alone. I wish it were different. I wish after a traumatic experience, all we had to tell people is, just give it enough time and it'll go away. But it doesn't. And it enters into lots of areas into people's lives, not only their moods and their behavior, but also their relationships, their work, their ability to be parents or spouses or friends. And it creeps into all of those areas in many people. It doesn't go away without doing something about it. And the something can be talking therapy, and there are a few types of therapy that work, and those are called cognitive behavioral therapy. The 2 most common types are called cognitive processing therapy and prolonged exposure, just so you'll know if you hear them. And then there are medications. Now, the bad news is that in 2017, we still don't have a medication that works for all of the symptoms of PTSD. We have certain medications that may help with some of the symptoms, like nightmares, or maybe helping people sleep better, or maybe the anger, or maybe depression and anxiety. But we don't have the equivalent of an antibiotic for the treatment of pneumonia. So if you had pneumonia, we could give you Tylenol for the fever and nose spray for your stuffy nose and cough syrup and muscle relaxants, but we don't have yet the equivalent of the antibiotic for pneumonia. The good news is that we're now working on medications which may help those with PTSD, either those in the civilian world or those who experience their PTSD from military or combat type experiences. These medications are being tested for possible FDA approval. Of course, drug studies are free to the participants, and so if you think you might be interested in trying one of these studies where you can get to experience perhaps these medications, these studies are placebo-controlled, so we can't guarantee what you get. But if you think you would be interested in participating in one of the PTSD studies, either as a civilian or as ex-military, please give Clinical Trials of Texas, saresearch.com, a call or check us out on the internet and apply to be a subject in one of the studies. I'm Dr. Harry Croft.